SOS Docteur. SOS Doctor. This is the national station of the CRTV, and this is SOS Doctor, your favorite Saturday morning health program. I am delighted as always to welcome you on board, and thanks for the pleasure of your company. Alisa Sambetata is my name, on duty with Matt Duren Sopokombi, the sound technician. And today we are discussing the intersection between HIV-AIDS and violence against women. There is strong evidence that the two are inextricably linked. 54% of all adults living with HIV are women, according to UN Women's Statistics. And women who are living with HIV often experience violence due to their HIV status, including violation of their sexual and reproductive rights. So, how did these women acquire the HIV virus? How are they managing the condition clinically? What kind of violence does their serological status expose them to? And what kind of psychosocial support do they need? These are the issues the panelists here present shall be addressing in the course of the program. Ladies, you are welcome to the program.
Thank you.
We have two charming, beautiful ladies here, Dr. Adidja Amani, who is a public health physician, and Ms. Mbusu Vivian Ekole, who is a social worker. You give them the questions and they will give you the answers. Our numbers 22208037 or 22220836. You can also send us an SMS on 9668041148. 9668041148. Don't go away, we shall bring you details in a short while.
Sabroso.
Welcome once more to our program. Dr. Amani, as I said, is a public health physician, and she's here to remind us about what is HIV and how the virus gets into somebody's system.
Thank you, Alice. HIV stands for
Human immunity. I don't know.
Immunodeficiency virus.
Immunodeficiency.
Perfect. Everybody knows that. Yeah.
No, we don't assume that everybody knows. Mm-hmm.
You can be infected with the virus, but you don't actually have the disease because the disease is AIDS.
Yeah.
So it's when you start manifesting what we call opportunistic infection that now you're at the stage of AIDS. Mm-hmm. AIDS stands for acquired immune deficiency syndrome. Mm-hmm.
So from the definition, it means the condition is acquired. Exactly. How does somebody acquire the virus? Essentially,
two main paths through sexual intercourse, unprotected sexual intercourse. That means vaginal intercourse, anal intercourse, or oral sex. Yes, through blood transfusion, or you might have a wound, and then if you get in contact with somebody else's blood or body fluids that are infected with HIV/AIDS, then you can
acquire
the disease.
Yeah.
Yes, there are the two main parts, but also an infected woman can, if she's pregnant, can transmit HIV/AIDS
to the baby.
Exactly.
Okay, according to the statistics we got from the UN Women, about 54% of the adults who live with HIV are women. Why are women more exposed to the HIV virus than men?
Thank you. That's a great question. There are many factors that make women more at risk of catching the disease. First of all, when you look at the anatomy of the woman, the vagina surface is more wider than the penis surface. So that's the first factor. The second factor is that during the intercourse, some friction might happen that will cause some laceration. That means very small, undetectable wounds And so this is a great path for the virus to get from maybe the semen to the woman. That's another thing. And here in Africa, many men usually have many partners. So the fact that one man can go with 1, 2, 3 women, and then, that's some of the factors that might explain the fact that women are more exposed to the virus than men.
Okay.
And I'm really happy that we also have a social worker because sometimes there are things like rape that expose women to the virus.
Yeah, Vivian, there is strong evidence that HIV-AIDS and violence against women have a relationship. Have you met a woman who has suffered violence because of her serological status?
Actually, I have witnessed a case, and a very pathetic one for that matter. There was this lady, the husband was infected without her knowledge. Apparently, after some time, she started manifesting the signs, the symptoms of the illness, got to the hospital, did her serology test, and she was diagnosed positive. So back home, she was taking the treatment, and the husband was taking the treatment behind her back because the husband was infected before she knew about her own status. Yes. So one day, in the course of her chores, her domestic chores, she just got across this drug, and she recognized the drug. And then, in the course of searching again, she now got in contact with the documents, the medical report of
her husband.
And when the husband came in, tried to discuss with the husband, but what is this? I'm seeing this drug, I'm taking this drug too, but I found you among your documents, and these are your medical reports showing that you are infected and stuff. And from there, it became from insults to battery to assault to many other things. And finally, she was brought to the social service, and before she could even narrate the story, she just collapsed. And you can imagine from there
what happened after. Well, we know that and we've been hearing about that women are very prone to gender-based violence more than men. Can you define to us what violence means? If they say we hear about gender-based violence, we hear about violence against women. What is violence? And is there a difference between gender-based violence and violence against women?
Okay, thank you very much for that question. Now, violence in itself refers to any act that results in physical, sexual, psychological, or emotional harm or suffering to women. Acts such as threats, coercion, arbitrary deprivation of liberty, which occurs in public or a private place. So that is just the definition of violence. And violence comes in different forms. And a woman who is not infected has this violence that is, she suffers violence. Okay. But now when a woman is infected, the violence is like twice what
an ordinary woman suffers. Yeah. So what are those kinds of violence that women who are suffering from HIV are likely to experience?
Okay. Women suffering from HIV are likely to experience physical violence, all the kinds, like physical violence, sexual violence, emotional violence, psychological violence. They will go through battery, assault, torture. They will go through sexual deprivation, that is denial of sex by the intimate partner. They will go through stigma, discrimination, insults, and so many other things, apart from the ordinary woman who is not infected. So you can imagine the ordinary woman who is not infected, she will have to go through rape, she will have to go through abuse, she will have to go through female genital mutilation, she will have to go through sex trafficking, sexual harassment.
Yes, Vivian, we shall come back to you. This is SOS Doctor from the national station of the CRTV. And today we are looking at the relationship between women who are living with HIV and AIDS and violence or gender-based violence. Some people call it gender-based violence. Some people call it violence against women. Not only women suffer violence, though.
Of course not.
Some women also inflict violence on their...
That's why I said gender-based is when violence is inflicted on the women, most especially by the men.
When it's exercised on the men by the women, what is it called? It's still gender-based, I suppose. SOS Doctor, national station of the CRTV. Let's hear from a caller. Hello.
Yeah, good morning, Katali.
Yes, good morning, Tony.
Good morning to my colleague there, and good morning to the doctors on panel. Let me first of all congratulate Katali for the first time that a media, a journalist is as a project social worker on this issue. That's excellent for you. Because I would appear that this issue of HIV and AIDS, the social services have been relegated to the background by the media. Whereas that is where the problem lies today, because we are talking about behavior. The issue of behavior is a serious issue where it concerns HIV and AIDS. I myself have done research work, observable research work. I've elaborated a program. I've sent to my hierarchy. I hope that those ideas expressed will be taken serious. I will come back. Thank you.
Thank you very much, Tony, for the compliments. And I think it's a very important issue. We have to talk about it. Doctor, we know that so far there is no treatment for HIV and AIDS. How is this condition managed clinically?
Actually, in 2013, the WHO has issued some new guidelines on how to manage HIV. You know, if you take your treatment as recommended by the new guideline, you can live a normal life. HIV/AIDS is not a death sentence anymore. As soon as you follow the guidelines, you follow your treatment, you can live with the disease and be healthy, quote unquote. Mm-hmm.
I think the drugs don't agree with some people, because when you look at somebody who has HIV/AIDS and who is on the antiretroviral therapy, you can know that probably the person has put on some weight, the person is looking deformed, probably the stomach getting bigger, the bust getting bigger, the buttocks getting smaller. Some people don't like this antiretroviral treatment. I know that you don't treat these patients, but if I should ask, why do the medications agree with some people and they don't agree with some other people?
Alice, it's like any disease. I mean, I saw you now be reacting to the dose around, but I didn't react. She didn't. Mm-hmm. So drugs have side effects. Okay. So, but the thing is that when you don't feel comfortable with one drug, there are alternatives. Mm-hmm. So they need to work closely with their doctor and let them know what are the side effects so that they can propose them some alternatives. Mm-hmm. So not everybody will react very well to a specific drug, but actually there are so many alternatives. So just not taking the drugs because you have one side effects, I don't think this is a good excuse. Okay.
Yes, Vivian, we have to talk about this aspect of violence. Tell us what kinds of physical violence is a woman who has HIV/AIDS or who is living with the HIV virus likely to suffer? Is
Most
it battery?
often, she will go through battery, she will go through assault.
Mm-hmm. Yes. Yeah, I think Matrin is indicating that there is somebody on the line. And there is a caller on the line. Hello?
Yes, certainly. This is Tony again.
We are listening to you. Briefly, please.
Before you people continue.
Yes.
The research I've done, that's a personal research work with my resources that are not even there. And so I am requesting, because the issue...
Just make the point. Tell us something about the relationship between HIV and violence against women. We'll appreciate that, Tony.
Yes, certainly. There's so much to be done. My colleague just typically gave an example there. There is this intransidency in couples when it concerns discovery of HIV and AIDS in one of them, where one of them does not want to disclose the information to the other. And so when this kind of antagonistic attitude occurs, there's bound to be violence on each other, where by accident, the other one discovers that you are undergoing a treatment where I am not, just for the sake of concealing the information. So this is dangerous. And so I am recommending that much chunk of money has to be given to this Ministry of Social Affairs, because the ministry has been empty when it contains...
Okay, thank you, Tony. You give us recommendations at the tail end of the program. Okay, actually, we shall be taking a news break, and when we come back, Vivian will be telling us about the kinds of violence that these women are subjected to and the psychosocial support they need. Don't go away, we shall be right back.